Hi everyone, my name is Teddy Bachour. I'm part of the worldwide public sector health team at Microsoft. Been at Microsoft a little bit over 10 years, working mostly as a developer consultant with healthcare organizations, help develop software or deploy software. And prior to Microsoft, I worked also about 10 years with a healthcare ISV in Connecticut, working on ultrasound fetal monitors and electronic medical records for labor and delivery. So I consider myself to be lucky and blessed in a way to be able to work both in IT and healthcare. Now, I'm very happy and honored to be here, and I'd like to spend the next few minutes that are left, 15 minutes or so, to talk to you about the work that we've been doing for the past 5 years, or maybe a little bit more, in the area of open source for health IT. And I'm not sure I'm going to have time to do questions, like my colleague Vaibhav said. Please feel free to connect with me after this session or at the email here if you have questions or comments. So I'm going to start with a very high level and quick overview about the world that these open source health IT toolkits, or most of them at Microsoft, live in, part of what we refer to as the connected health platform. And then I'm going to move to talk about 3 specific open source toolkits from the connected health platform that we released in the past 3 to 4 years. We're keeping up to date, and last of which was released a couple of months ago. And finally, I'll show you some of the resources that are available to get more information if you're interested in learning more or in using these toolkits. So what is the Connected Health Platform? Back in 2006, we released the initial version of what is known as the Connected Health Framework Architecture and Design Blueprint. It is today about 400-page document that outlines a vendor-agnostic architecture for building standards-based and service-based health IT solutions. And then we got a lot of comments from individuals, from customers, from partners saying, we like this architecture document, but I am already working with Microsoft technology. Can you tell me how we apply these principles using Microsoft products and technology? So we started building what is known now as the Connected Health Platform. So basically, the Connected Health Platform is a set or a collection of technology offerings that align with the Connected Health Framework, but use Microsoft technology. So today we have about 40 prescriptive guidance documents, and about 10 toolkits. Some of them are open source on Codeplex, some of them are on the MSDN, and some are on Microsoft.com, all available as at no charge to download and look at and use. And most of these guidance and toolkits were built and developed by a team at Microsoft working in the UK with the NHS, the National Health System, in the past 5 or 6 years as part of our a good relationship we had with the NHS. We agreed that as we use and develop IP and guidance and toolkits to help them deploy the Microsoft technology in their environment, that we will be able to share these with the larger community. So we repackage them and we release them at the link that you see below, which provides you links to different places like Codeplex or MSCOM or MSDN. So these are the 3 toolkits that I want to talk a little bit about in more details out of the 10 that I mentioned exist today. And they are related in the sense that I was hoping that if I had more time that I will be able to demo how these 3 can be used together, but I can at least mention it. The common user interface, which I will go into details with, about each one of these, but can be used with the clinical documentation solution Accelerator to build documents that contain clinical data following certain standards that Vaibhav referred to earlier, like HL7 and SNOMED. And then once you have the document, which could be a clinical summary document or visit summary document, that you can use XDS, the Cross Enterprise Document Sharing Standard, to share that document between, for example, the lab system that prepared the discharge summary with the primary care physician who may be located in a different system. So the common user interface, basically at a high level, there were 2 objectives for the team in the UK who was working with the NHS for them to build the common user interface. It is the first high-level objective was to build guidance for clinical user interfaces that focuses on patient safety. So try to eliminate or at least minimize the patient safety risks related to when clinicians are using user interfaces. And I'll show an example of how that is the case. The second objective is to create a UI design environment that helps promote efficiency when clinicians are using the user interfaces so that they can spend more time caring for their patients, which is what they want to do and what they get paid to do, as opposed to having to deal with complexities that a specific user interface design presents to them. A very simple case that we show here about 2 guidance and 2 UI elements for patient name and date of birth. You see here 3 potential applications, each displaying the patient name and the date of birth in a different way. And as Vaibhav was mentioning earlier, some hospitals have about 100 applications. You can see the effect that this would have on a nurse or clinician or a physician as they have to move from one application to the other, just caring for the same patient. These could be like on the same nurse workstation in the bedroom. So it does get its impact on the nurses as they are going from one application to the other. You may think, for a person my age, if we talk about the date of birth, 12/8, XXX, I'm not going to say my age, but 12/8 can be December 8th or can be August 12th. It will probably not have an impact in my case, but when you think of someone who is 2 years old or 3 years old, few months can make a difference because the type of medication that you provide would be different at this level, a difference in months. Or if we think about these being dates and times of when medication was prescribed or when a certain procedure was given, you can see that this can become potentially harmful or highly impactful on the well-being of the patient that is being cared for. So what the guidance does is basically is a document, a specification document that says, well, if you want to build a control that will host a patient name, these are the rules that you need to work with. And some of these guidance documents were in fact, all of them were developed working with clinicians with the NHS, and some of them took months to develop. They had like cameras looking at nurses, how they are interacting and moving, and so they did a lot of usability studies to in the end, come down to a specific set of specifications. So in this case, if everybody or most clinical applications in the hospital are following this guidance, then the nurses would not have to deal with the disparities and with the risks of those disparities that can present to patient safety. I'm going to show a video shortly that shows how this would work with the Clinical Documentation Solution Accelerator. So the Clinical Documentation Solution Accelerator is another open toolkit that we released a few weeks ago. And it uses the common user interface component. So the screen that you see on the right has common user interface components embedded in it. And I should have mentioned during the CUI segment that in addition to the guidance documents, we have also implemented this guidance documents using Microsoft technology, which is what we are making available as a toolkit on CodePlex. So you can get the controls themselves, and you can get the source code if you want to extend those controls to fit the specific needs of your application. So in this case, the Clinical Documentation Solution Accelerator, you can embed these components inside in this case, the Word document, and basically be able to use templates. So you can import specific templates, for example, discharge summary template or visit summary template, and then clinically encode the information directly into the document. And the encoding can be to a specific standards like HL7. Also in the kit that is available as part of the open toolkit, we show how you can connect to external sources like cloud resources through like web service calls, or in the case that we have, we're showing how you can connect, for example, to a partner web service to do terminology translations like SNOMED, ICD-10. And also we show how you can connect to another service provided by another partner, First Data Bank, to do drug checks or drug allergy checks. And you can do that real time from the document container itself. So why CDSA? We think that by using this approach, we really get like the best of both worlds, to get machine readability and to get human readability. With the CUI components embedded in the document, you get efficiency and improved safety controls. And with the fact that it is immediately translated through, for example, connection to the terminology service, to a specific ICD-9 code or ICD-10 codes or whatever is needed in the specific country, that you get machine readability that allows you to do this semantic exchange that Vaibhav talked about, so that all the systems can really understand when we tell them, gallbladder, they understand that this is gallbladder and nothing else. So I'm going to
Hello and welcome to the Clinical Documentation Solution Accelerator, or CDSA, end-user video. The CDSA for the Microsoft Office system is a connected health platform resource enabling you or your customer to define and create encoded clinical documents. The following video demonstrates how to complete the example discharge summary template that is included with the CDSA download pack. Please note that this example template is not for real clinical use. The scenario used in this video extends that shown in our patient journey demonstrator of a Mr. Brian Johnson who is experiencing chest pains. This can be found under the Showcase section of www.mscui.net. In this scenario, Mr. Brian Johnson is experiencing chest pain, and following further investigations, he is admitted to hospital for an angiogram and angioplasty and is now ready for discharge. To begin, The clinician creates the document from the discharge summary template. In addition to the familiar word features seen here, this CDSA template includes a document summary pane on the right-hand side, which provides an overview of the sections that contain encoded clinical terms, such as those from SNOMED CT, ICD-9, ICD-10, READ, and RX Norm. There is also a CDSA tab in the ribbon to allow access to specific functions. CDSA allows for the pre-populating of information from a host system where possible. For the purposes of this demo, we have assumed some of this functionality and pre-filled some sections, such as here in the patient banner and PCP details. Now, let's begin inputting some text in the next section, the reason for admission and presenting complaints. In this section, a clinician can enter free text. For example, patient presented with shortness of breath, nausea, and chest pain. These can then be looked up using the Find Matches button. As you can see, the possible clinical term matches are highlighted in grey and are also shown in the corresponding section of the document summary pane as a list of checkboxes. The clinician can then review each matched term and select for encoding, or you can make changes to incorrect matches by clicking on the clinical term and beginning a new search. As you can see, the free text section is updated accordingly. To update or add more text, the clinician clicks the Edit button. Please note that this feature is only safe in some contexts. For more information, please refer to the CDSA Patient Safety Notes. Now let's move on to the next section, Diagnosis at Discharge, which demonstrates how specific clinical terms can be searched for. To search for a clinical term, the clinician clicks the Add button, types the term, for example, myocardial infarction, and clicks the Search button. Select the required clinical term from the list and click Save. The term is now added to the table as well as the document summary pane. This can still be edited or deleted. The next section of the template to show is the clinical narrative section. Like reason for admission, it also uses a free text control. As previously demonstrated, the clinician enters some free text into the free text parser. The possible clinical term matches are returned and displayed on the document summary pane. As demonstrated earlier, the clinician can confirm the matches by checking the boxes. Next, the clinician moves on to the discharge medication section and enters some medications.
I'm going to move forward because I'm running out of time, but this video is available. You'll see the links at
To
the
do
end of
this,
it. So the cross-enterprise document sharing is a standard that was developed by IHE, integrating the health enterprise. IHE develops interoperability specification to promote interoperability and enable basically the coordination of care between different systems using standards format. They don't develop standards, they profile standards, so it's more like a standard profiling organization. They use existing standard like HL7, web services, SNOMED, and they just create a specification that provides guidance to developers how they can put together these standards to build systems that can interoperate with each other. So we have an open source implementation of cross-enterprise document sharing, and this slide is showing here what we implement from the XDSB standard. These are called transactions in the world of IHE, and every year we keep the code base up to date by going to a special event, very intensive testing event called Connectathon in Chicago, where we run against other vendors that are using Microsoft and non-Microsoft technology. For 5 days, we test our system with theirs and make sure that the open standards are really working. And this is how IHE XDSB would work. So if you have the lab, for example, in our example, the lab prepared the discharge summary. They want to make it available to the primary care physician. They use their application to submit the lab results to the IHE registry and repository. So the document is submitted with metadata about the document to the repository. And then what the repository does is it sends the metadata to the registry. Metadata is basically information about what is in the document, certain attributes that can then be used by the primary care professional who is in a different health system to send a query to the registry using these parameters. The registry is going to return links for matches that it found based on the selection criteria. And then the physician using the application can retrieve the document from the repository. So resources, Vaibhav showed this slide. The first two are for Common User Interface and CDSA. They are on Codeplex under Microsoft Permissive License, MSPL. And the third one, the IHE. The third one, a Clinical Documentation Solution Accelerator, is available on MSDN. And I have links to the specific licenses in each case. Oh, no, that's not what I wanted to do. Sorry about that. Some additional resources we have for each one of these toolkits. We have educational material videos that you can look at that talk about different scenarios, clinical scenarios. And these are the resources for Vaibhav for the Health Vault resource toolkits that you have available. And I did run out of time, but if I don't know if you have any questions now or if you want to follow up.
I think there's 5 minutes.
I think 12:40 is. So I do appreciate your patience. Yeah.
This might be a basic one, but what platform does it run on? The software that you showed a demonstration of?
Yeah.
Is it Windows only or does it run on other platforms?
They run on Windows. Yes. They can talk to, like XDSB because it uses web services. The registry can be running, you can use the registry from Windows and repository or the source and what is it referred to? The document consumer can be, totally different systems. But our toolkit needs to run in a Windows environment. Yeah.
And you said that this signed off on the user interface as being relevant for healthcare?
I said that.
That the NST NIST signed off as the user interface studies in healthcare for that design?
I'm sorry, I didn't get the question.
I'm asking about the government support or studied support in healthcare for the user interface design, the UI.
Yes. And what did I say about that?
You were saying that their studies indicated through, recording clinical use and so forth that the component set was valid for healthcare. And I guess I'm asking if I heard that correctly.
No, basically what I was saying was that the guidance documents that are available as part of the common user interface were developed in coordination with the NHS clinical people. And they are used by the NHS today. we did not do other types of research around that. But those toolkits that you saw, the 40 guidance and 10 toolkits, in the past 12 months, we've had about 70,000 downloads. And I don't know who these people are, but we just know that this is how many are downloading these toolkits.
I'm sorry to interrupt you, but I'm the next talk.
Yes,
I'll have to squeeze in. So.
absolutely. Thank you very much.